Hi and welcome. Let's briefly look at the gross anatomy of the levator ani muscle. So the levator ani muscle is a broad, thin, funnel-shaped skeletal muscle forming the major part of the pelvic diaphragm. It supports the pelvic viscera and plays a critical role in continence and childbirth. So you can see the levator ani muscle here forming the pelvic diaphragm, and it plays a critical role in supporting the pelvic viscera. So you can see it here again. You can see its funnel shaped structure. You can assume this is the upper part of the funnel where the water enters, and this is the tip, the lower tip of it where the water comes out from. So you can see the upper part is broad and it is less broad down here. So what are the components slash subdivisions of the levator ani muscle? The levator ani consists of three paired muscles known as the puborectalis, the pubococcygeus, and the iliococcygeus. So this is the iliococcygeus here. This is the pubococcygeus here. You can see the pubococcygeus, and this is the puborectalis. The puborectalis always forms a sling around the lower end of the rectum. So we'll be looking at the parts of the levator ani muscle and their origin. We'll begin with the puborectalis, which originates from the posterior surface of the body of the pubis. So this is the puborectalis originating from the posterior surface of the body of the pubis, and then forming a sling, a U-shaped sling around the inferior part of the rectum. Next is the pubococcygeus, which is originated from the body of the pubis and anterior part of the tendinous arch. So you can see the pubococcygeus, which is here. It originates from the body of the pubis. You can see the body of the pubis around here, and then it also originates from the anterior part of the tendinous arch. So the anterior part of the tendinous arch is around here. So this is where the pubococcygeus originates, both sides. So next is the iliococcygeus, which originates from the tendinous arch of the obturator fascia and ischial spine. So this is the tendinous arch of the obturator fascia, and you can see the ischial spines here. So it originates from the ischial spine and the tendinous arch of the obturator fascia, and this is on both sides. So the tendinous arch, which is also known as the arcus tendinus levator ani, a thickened band of obturator fascia extending from the pubis to the ischial spine. So this is the tendinous arch. It extends from here to the ischial spine here. So whenever you see this, you know this is the tendinous arch, also known as the arcus tendinus levator ani, and it's on both sides. You can see this side too. So now we'll be moving to parts of the levator ani muscle and their insertion. So we'll begin with the puborectalis, which forms a U-shaped sling around the anorectal junction. So this is the anorectal junction where the rectum and the anus come to merge together. So this is the U-shaped sling. It goes this way and passes like this. So that's where it's inserted. Next is the pubococcygeus. The pubococcygeus is inserted at the anococcygeal ligament, the coccyx, and perineal body. So this is the pubococcygeus muscle, and it is inserted at the anococcygeal ligament, the coccyx. You can see the coccyx is around here. It inserts around here, and the perineal body. Next is the iliococcygeus, which inserts at the anococcygeal ligaments and the coccyx. So it inserts this around here, that's the coccyx, this part here, and the anococcygeal ligament, the ligament extending from the coccyx. So we'll be looking at the nerve supply to the levator ani, which is from the S3 to S4 nerve roots. It comes from inferior rectal branches of pudendal nerve. That's the minor contribution. So you can see we have the nerve to the levator ani muscle here, and we also know that it originates from S3 to S4. So next is the blood supply to the levator ani muscle. The blood supply to the levator ani muscle comes from the inferior gluteal artery and internal pudendal artery. So this is the inferior gluteal artery and this is the internal pudendal artery. Both give blood supply to the levator ani muscle. So let's move to the actions / functions of the levator ani muscle. The levator ani muscle gives support to pelvic organs such as the bladder, the uterus, and the rectum. It maintains fecal and urinary continence. The puborectalis maintains the anorectal angle. The levator ani muscle helps in increasing intra-abdominal pressure, especially during coughing and sneezing. The levator ani relaxes during micturition, that's passing out of urine, defecation, and childbirth. So what are the relations of the levator ani muscle to other structures of the pelvis? Superiorly, it is related to the pelvic viscera. Inferiorly, it is related to the perineal structures. Medially, it is related to the pelvic organs. Laterally, it is related to the obturator internus muscle. So what are the openings in the levator ani muscle? We have the urethral hiatus, that's where the urethra pass through. We have the vaginal hiatus, which is here, and we have the anal hiatus, which is here. So what are the clinical significance of the levator ani muscle? Damage during childbirth will result into pelvic organ prolapse. Weakness will result into urinary or fecal incontinence. Puborectalis dysfunction will result into defecatory disorders. It is strengthened by pelvic floor exercises, also known as Kegel. So now, in summary, the levator ani is a pelvic diaphragm muscle composed of puborectalis, pubococcygeus, and iliococcygeus, innervated by S3 to S4, essential for pelvic support and continence. Thanks for listening, and do not forget to like, share, and subscribe if you found this video helpful.